Thank you, Mr. Speaker. Members, this amendment is about the provision in the bill that would take away federal grants. So federal grant funds are proven life-saving programs. Many federal grants support violence prevention, crisis intervention, and mental health services, the very programs that help communities reduce gun deaths and save lives. Refusing these funds limits Texas's ability to implement programs that are working across the country. Turning away funds harms local communities. Cities and counties, especially those hit hardest by gun violence, like parts of Houston, Dallas, and El Paso, rely on federal dollars to support community-based safety efforts. Prohibiting access to these grants takes tools and resources away from local governments and law enforcement. This would be fiscally irresponsible. Texas taxpayers already pay into the federal system. Refusing these grants means Texas funds programs in other states while getting nothing in return. That's not just harmful, it's fiscally wasteful. Local control should be respected. By denying the acceptance of federal grants, SB 1362 strips local jurisdictions of the right to decide what's best for their communities. Cities and counties should be able to access available resources to keep their residents safe without interference from state lawmakers imposing one-size-fits-all mandates. Blocking grants undermines public safety innovation. Federal grants help pilot innovative, evidence-based solutions from hospital violence intervention programs to community outreach teams. SB 1362's rejection of these funds stops Texas from participating in nationwide progress on gun violence prevention. This provision is politically motivated, not publicly supported. Most Texans across political lines, as you just heard Representative Bryant say, want practical, common sense safety solutions, not political grandstanding that blocks help. Stripping this provision focuses SB 1362 on real public safety concerns, not ideology. Removing the grant ban protects the most vulnerable. Communities of color, low-income neighborhoods, and areas with high gun death rates are often the intended beneficiaries of these federal grants. Cutting off funding to these areas perpetuates inequality and undermines statewide safety goals. With that, I move adoption.
Mr. Hefner.
Thank you, Mr. Speaker. Members, we worked on this bill for a while. We took the amendment that we believe gets the bill where it should be for the Senate to concur, and I ask you to vote with me to oppose this amendment.
It's a good one to close.
Members, by his argument, we should never change bills that come before us through the debates that we have back and forth when we think of things that might strengthen the bill or things that might make a bill better because they've already been heavily negotiated. That's what we're doing here right now, is looking at these bills and figuring out what makes sense for our communities and the state of Texas. And by saying that we're not going to take federal dollars, these federal grants that, again, help our hospitals with violence intervention programs is just not smart. So please vote with me to adopt this amendment.